information sharing about what happens on labor and delivery. And so I think that it happens in a variety of ways. Consumer-driven kind of creates the questions for people who aren't aware, but then institutions can gain that information from other institutions.
Word spreads. There are a couple nurses down at Westerly Hospital who are very interested. Couldn't make it today, but they're very interested in hearing about it, and they think that Westerly Hospital would be a good place to implement it. Small hospital, it's baby friendly, and
we'd be happy to come.
Yep.
I actually received a message on Facebook from a nursing home at the hospital in Rhode Island, and they're doing the cesarean there. So if you ever get stuck on one of the islands, you know which island to go to.
Yeah. And also, one of the postpartum nurse managers at Women and Infants really wanted to come and wasn't able to make it, but asked me if there were any handouts to get them.
Yeah, which we did. I'm happy to just give you this presentation also. I mean, this is just something I created over the last couple of weeks as I was preparing for this, and anyone can have it, and we can put it on the website for if you'd like to. And I know you guys over here, especially you, raised your hand 20 minutes ago.
I was wondering how complicated it was with twins.
How complicated is with twins with gentle cesarean? That's a great question. I haven't yet done one yet. Have you done a gentle? Have you had to have a cesarean for twins? Because we've had vaginal births for our twins.
We have a nice
high five.
vaginal delivery for twins for the last 3 or 4.
Yeah.
It's the complication with the difference with twins is that there are more people involved, and so there's a people factor that has to be managed because there's a separate team for each baby. But it pretty much can be done in the same way.
I would imagine that I would probably recommend that the partner get ready to get naked, and be the skin-to-skin person for the second twin or the first one, depending on how the partners decided to make it work. But that would make a lot of sense. We could, bound, that partner and baby together. It would be the first time we're doing it, but that would be like my first thing. Would say there may not be a lot of chest room because you can only go down so far. It may, and yes, that first child could breastfeed, and then of course they could switch. I mean, I'd probably get a breastfeeding specialist in to help me think about it. I'd be talking to the doulas. What do you?
I was wondering, you're slowing things down, and so then it's double the time.
Right. Oh, in terms of,
I think we could do it. I think we could probably. We just have to orient the babies the way they were in the uterus.
Right. Great idea.
If you just orient them the way they're used to being in the uterus.
Yes.
Oh.
Genius. But I also like my partner. Going skin to skin with one of the babies and maybe either one would work. Dirty old doctor.
Yeah, we're not going with that now. Never mind.
Sir, you will be
right. Men of America, take off your shirt. I love it.
I just wanted to, I jumped in late, but I was a beneficiary of gentle cesarean with this one. So it definitely is what I feel like, saved really helped make the experience okay. Because she wasn't whisked away. And in terms of kind of education, I do think it's just, what I didn't actually realize how lucky I was and how rare it was until really after, and I started telling people this is what people were like, what? I didn't even know that was an option. And so I told a lot of people and had someone who was delivering twins at Women and Infants ask about it. And they were told, or she was told, never happens there. So that's good to hear that can happen. And her the answer she was given was, oh, and you won't even want it because, there was some reason why she wouldn't want skin to skin, and to kind of justify or rationalize it. But I also put a picture of it in my birth announcement, and I sent it out really widely, and I put a caption and said, I got to do immediate skin to skin, and so that even just got generated people. Responding back, and then I feel like one of the most touching things was, initially it made me really nervous. The anesthesiologist was a student, right?
Yeah.
Because the main reason I did not want an epidural or C-section was like the needle and the spine thing. So obviously I had to have one, and it was fine. I mean, it was fine. And actually the really rewarding experience was that this student anesthesiologist was so moved by the experience. And he said he was just commenting the whole time, like, how beautiful, this is the best delivery he'd ever seen. He'd never seen immediate skin to skin. You know, how the babies had always been whisked away, and he was just so moved by it that touched me. You know, equally, you know.
That is a huge message. Like that's going to happen when this person is done with their training and wherever they're going to go, because it probably won't be Memorial Hospital. That or nurse anesthetist program, they typically go elsewhere. And so what will they do when next time they see a cesarean? Hey, back when a hospital I trained at, they went skin to skin, and everyone kind of says, "What, really?" And it sets off this domino effect.
So that's how it's going to happen.
Frankly.
You know?
Yeah.
And I may have missed this question before, but what is the concern, I guess, but why is this so uncommon? Why is it so traumatizing? What is the...
It's the inertia in medicine. It's like the way it's changed. It's the way it was always done. And I think nobody really thought about it because I don't think people maybe opened up the way they are now about their negative experiences with their cesareans. And I think the internet probably helped in this process because women from all over the world got to talk about their experiences and both their negative and their positive experiences, and that was probably something to do with it.
Protocols are so regimented in the ORs particularly too.
Right.
That probably more than other areas of medicine.
Fear of infection and sterility being broken and all these other things that I think,
Yeah, I just think that C-section has evolved as a surgical procedure, not as a sort of mom-baby-friendly experience, and so it fell into the very regimented way that most surgery happens, and that's the way you kind of want it to be from a surgical point of view. And so that's sort of, it unfortunately fell in that category. And delivery is kind of, it's not exactly a procedure in the way that the processes happen. So people are awake, they talk to you, you know, it's an interactive kind of thing. It's sort of it's a C-section kind of fell in that surgical realm, I think, more, and now it's being more brought back to the sort of experience.
Well, it makes sense that it's evolving from what seems like I was going to have a home birth, you know, so this was obviously a shock to his breech, but that you were still accommodating me as much as you could, so it makes sense that it would evolve from that. But then even people who, don't go into planning a home birth or even a natural birth, a C-section may still, they will certainly benefit.
Kaylee, just to go back to one thing you were saying is that patients can transfer at any time. I've met a patient 12 hours before I had a birth with her and said, I'm not going to but I will say that I did meet a woman. I did meet a woman who said, really, I have a breech baby, you made me think of this, and I just want to go into labor. I want to know that the baby is telling me it's time, and my doctor won't let that happen. They want me to deliver at 38 weeks by cesarean, regardless of whether I'm having contractions or not. And it turned out she was so stressed out about this thing, and we talked about it. I said, well, absolutely you could transfer to us. We checked her cervix, and 2 hours later she called the hospital. She said, I think I am in labor. And I was like, please come back. We'll check. And I stayed there. We checked her, and she was 3 centimeters. She was clearly in labor. She had been 1. And we had her cesarean a couple hours later. John and I did it together, and which we often do, by the way, if it's not John and Mary or me and Mary or something like that. And it was great, and she was so pleased. Because, of course, she went skin to skin and all those things because that's what she needed. And why it was such a, I don't know what her provider thought. Like she was gonna have a breech baby on her kitchen floor. It was her first baby. I don't know what the issue was, but she ended up knowing us for 12 hours and was really happy with her care. Yeah.
I have a weird question. I should know this probably. Are there other OBs at your hospital, and are they on board with this?
There are.
You guys
Well,
here?
our practice is pretty much the only OB practice that.
Are the other OBs on board with this?
To different degrees.
Yeah.
Different degrees.
Like, because you guys aren't always going to come in when it's one of my moms that has to. Are you?
Most of the time.
Yeah.
If it's Mary, who else are you working with? That's pretty much it,
Oh,
right?
I know.
Yeah.
So my practice is called Women's Healthcare Specialists, and there are 3 of us. The head of my practice is also the chief of obstetrics at Memorial, and so he's on board from the policy point of view in terms of he's the older guy. And then I have a new partner, Jenny Long, who's also really great. Has had some experience working with family and working in Mexico, and so she's more on board because she had great experience.
a lot of this part, Jessica, is driven by the post-obstetrician part of it too. I mean, if thinking about it, you know, some of it is, I mean, whoever clamps and cuts the cord, usually that's the person at the OR table, right? So that could happen quickly, but, and too quickly, you know, because we like to delay that, right? But then the baby is often handed to what is usually a family medicine resident, and that's where I'm coming in and saying, allow trainees at your birth, because they're the ones that are being told by me, this is the way it should be done. If that baby's vigorous, not blue, is appearing comfortable, bring that baby onto mom's chest and try and stimulate there. Don't use the cooler. Use the warmer, mom, and do it there and see what happens and see the kind of differences that you get in a hospital stay. Watch that mom-baby pair. You know, take notes about what's going on with their bonding and their breastfeeding compared to the moms who didn't get to do that. We're starting to collect data about this, not, you know, not in a quantitative way. We need to, we should. Just getting it to happen was a big feat, but that's the next step, is collecting data and seeing what the experiences are really like, not only from a qualitative aspect, what moms think, but really, are breastfeeding rates better at 6 months because we were doing this? That would be enough for me. Less postpartum depression? It's enough for me anyway. I don't care if the outcomes don't show it.
Yeah.
Even if just moms are happy, that's
Just
it.
removing that trauma aspect, the fact that you're having a lovely, you're just starting it with not having to have all that trauma around a cesarean. You're starting it 1,000 times better. Whether or not breastfeeding, you're creating a more confident mom.
Just the piece about people not chatting amongst themselves is huge.
Yes, it is.
Yeah, it was, my wheels were turning as I was sitting here thinking, I want to put a sign on the OR door that says, shh, birth in progress, or something like that. Like, I'm trying to sit a way that's not going to make people be offended by what I'm saying, but in a way that's sort of cute enough that it'll make people smile, but they really will shut up. You know, I'm trying to figure out how to do that, so if anyone has any ideas, aside from birth in progress or something, let me know.
Amazing concept.
Right, I don't mean.
Right. Don't talk to me, Jeff. Talk to the patient.
Right, the Red Sox chat I'm talking about.
Right, exactly, right.